Hi, welcome to the Health Corner here on the Breakfast Show on Camnet TV. I am Dr. Nakuyana Mfaya. This week we have been talking about hypertensive heart disease, and we discovered that hypertensive heart disease is a condition that comes when you have elevated blood pressure for a very long time. That leads to complications in the heart and causes the heart muscles to become bigger in size, and it can also cause certain damage to the arteries of the heart that can cause a heart attack or myocardial infarction. We also say that hypertensive heart disease can have certain symptoms like back pain, chest pain most of the time, which feels like a heaviness in the chest, or it feels like there's a squeezing pain in the chest. It can radiate to the back and also to the arm as well, the left arm. Then you can also have other symptoms like palpitations in the heart and swelling of the feet. We also say that hypertensive heart disease can be diagnosed in the hospital using a scan for the heart called an echocardiogram and an ECG that can help to show how well the heart is functioning, and if there's any dysfunction in the heart, it will be able to tell and show whether you have hypertensive heart disease or not. We also say that hypertensive heart disease can be managed with some medications, mostly the medications that help to reduce blood pressure in the body and also reduce your cholesterol and reduce your blood from forming clots in the body. So today we'll talk about the lifestyle modifications that you need to do, certain things that you can do at home to reduce your blood pressure if you already have hypertension, and also to prevent yourself from having hypertension or hypertensive heart disease. So number one is that you need to reduce the amount of salt that you eat at home. If you eat too much salt in your food, you are at risk of having hypertension. So reduce the salt that you eat. If you already have hypertension, then you need to reduce your the salt intake, because it will help to reduce your blood pressure. The second thing is that you need to be able to include a lot of vegetables and fruits in your diet. Mostly you want to include fruits that have high potassium, because potassium can help to reduce your blood pressure. Foods like oranges, bananas, tomatoes, avocados are rich in potassium and should be included in your diet to reduce your risk, or to reduce your blood pressure or your risk of having hypertension. The other thing that you need to do at home is that if you take alcohol, you need to reduce on your alcohol intake, because alcohol can increase your risk of having hypertension, or even increase your hypertension your blood pressure if you already have hypertension. The other thing that can be done is that you need to reduce your weight. If you are a person who is obese, or you are overweight more than you are supposed to, then you need to reduce your weight, because obesity is a risk factor for many other diseases apart from hypertension. It can increase your risk of having diabetes, renal conditions, and even heart disease itself. So you need to reduce on your weight if you are obese or overweight. The other thing is that you need to be able to keep an active lifestyle. You need to be more active in your life. If you do not exercise, then it's time for you to start exercising. There are so many other things that you can do in place of exercising. You don't only have to go to the gym, but you can ride a bike, take a walk, and do certain things like dancing at home that can help to increase your activity levels every day. You do not have to sit the whole day with work. People are seated most of the times in their offices, and if you don't work in an office, then maybe you're at home most of the time and you're just seated, but you need to be able to get up and do some physical activity, because it's important for your heart healthy and also for your body itself. It needs to be healthy and it needs to be active. So these are some of the things that you can do to prevent yourself from having hypertension. You can do these things to prevent yourself from having so many other complications or other conditions in your body. So this has been the talk on hypertensive heart disease and how you can reduce hypertensive heart disease, or even reduce your blood pressure if you are already hypertensive, or reduce your risk of having a progression of hypertensive heart disease or any other condition, because it helps to reduce the effects of these diseases in the body. So you can exercise, you can reduce your salt intake, and eat more fruits and vegetables in your diet. So thank you so much for watching. I do hope you have learned something. I'll see you again next week.